All right, I'd like to welcome all the viewers to this interview with Dr. Christy Dempsey. She's the Chief Nursing Officer and President of Clinical Excellence at Prescani Associates, and she's responsible for providing clinical guidance and helping clients transform the patient and the caregiver experience. She's been a registered nurse for over 30 years. She has a doctorate and is very involved in really providing leadership for nursing, connecting the nursing, making the connection between nursing and the patient's experience. And I'm very excited to have her here on this interview because I think she has this wonderful perspective on how we can evaluate our professional nursing roles and giving feedback to institutions on our professional practice. So I am very honored to have her here. So I really feel that your wisdom and foresight to what the future holds for us as nursing is tremendous. So I wanted to ask you, what are some of your visions of how we can create the future of nursing and make a better impact on what the needs will be in healthcare as we move from this period forward?
Great, thank you. I'm so honored to be invited to talk today. You know, 2020 is the year of the nurse, and who knew that the year of the nurse would involve a pandemic and everything that has happened. And for one, I am so grateful to all of the nurses who have stepped up and are taking care of patients and each other and everybody else. You know, I think out of this has come a lot of, we're not calling them best practices because who knows if they're really best practices, but they are emerging and adaptive practices that incorporate innovation and leadership and scholarship that I think will continue well beyond all of this. You know, telemedicine and the leadership that advanced practice nurses are providing right now, the move to team nursing that we've been talking about for a long time, and now we're doing it and seeing what a tremendous difference it makes. So those are things that I think will continue long after this pandemic is all over, because I don't think anybody's going to want to go back to the way it used to be. Now we know that there are things that we can do better, and you know, it was born out of necessity.
That's true. One of the things that I think that's happening right now is we are being catapulted into what the future is.
Right.
So tell me how you see that this can inspire us to co-create. One of the things I'm really interested in is how we can listen to the voices of leadership, people who've been in the field a very long time, who've been working to create different models. What are some specific steps that you think we can take out of this time that we're being challenged to move into the future? What are the best things that we can, what do you see, in your opinion, some of the best things we can do moving forward?
You know, I think it's very interesting. You talked about the leaders and the people who have been in our field for a really long time who have so much wisdom to convey and impart. I also think we have a lot of people who are earlier in their careers that have an awful lot of wisdom and innovation that we should listen to. It's kind of similar to what we see in the healthcare environment, right? With the multi-generational group that we have in healthcare today. And each group brings something very unique and important to the table. So while I think it is important that we listen to the people who have the experience and the wisdom, I think it's also important that we listen to the people who are coming in with new and fresh ideas and innovation, and it's putting those things together. And I think that's what leadership does, right? True. Leadership pulls all of the best ideas and work and and innovation and creativity from across the continuum, whether it's the continuum of care, the continuum of multi-generations, the continuum of the workforce, pulls it all together and makes it something special. So I think we have to do both of those things. I think there is also a tremendous opportunity right now for advocacy. You know, there are nurses in Congress. I think at last count, there were 5 nurses in Congress. Did you know that?
I knew it's hard to get a hold of them.
Exactly.
I've been trying to call them.
Most people don't know. And so we have a tremendous opportunity as nurses to advocate for our profession, because nursing is not a job. It's not a job. It is a calling. It is a profession. It's not simply a job. And so as nurses, we need to advocate for our profession. And so when we are able to take on leadership roles like Congress, you know, let's make sure everybody knows that we're nurses and that we advocate for our profession. Most of the time, you know the physicians who are in Congress, but we don't know the nurses who are in Congress. And we should.
We should. That's really important as we get involved with more leadership positions. Nursing are stepping out of the traditional role of nursing, and they're moving into these leadership positions. And I think it's incredible the contribution that because of them being nurses, they can make a unique contribution.
That's right. I think the holistic nature of nursing is unique. And I think that we need to make sure that people, not just patients, but people in general, understand what it really means to be a nurse.
Mm-hmm.
You know, it's not about taking vital signs or being able to start a really good IV or you know, document on the electronic health record. It's so much more than that. And, you know, I talk about compassionate connected care as the framework, the action model for suffering, whether it's a patient or a caregiver.
Right.
And I chose those 3 words very carefully because it's not enough just to be compassionate. And it's not enough to give great clinical care. It's the connection between compassion and clinical care, the connection that we have with our patients and with each other that really makes the difference in nursing.
That's great.
So,
tell me that again.
Compassionate connected care.
Okay. That's important. I love
It
that.
is.
Tell me more. Tell me more what that's about.
So my colleague, Dr. Deirdre Mylod and Dr. Tom Lee, developed a suffering framework. And it shows that patients and caregivers alike suffer. And we talked a lot about whether or not we should use the word suffering.
Mm-hmm.
But that is what it is. And even though I pushed back initially on the word, because who likes the word suffering? Nobody. And if you tell me as a clinician that my patients are suffering, I feel like I'm not doing something that I should be doing.
Mm-hmm.
And so I pushed back until I became a patient. I was diagnosed with breast cancer. And I realized at that point, suffering is the right word and we ought to be talking about it.
Yeah.
And there are 2 ways in this suffering framework that people suffer. So there's inherent suffering. So even if healthcare were perfect, the diagnosis and treatment alone would cause suffering. And we can mitigate that, but we can't eliminate it.
Mm-hmm.
But then there's an awful lot of suffering we actually impose on people when they come to us for care. You know, when we make them wait, or when we don't provide clean, quiet, healing environments, when we don't work well together as a team, those things cause suffering too. And those are totally avoidable.
Right.
And so we started looking at the data that way, looking to say that, you know, we can actually use the surveys, whatever survey, as a proxy for suffering, because surveys ask patients to tell us and caregivers what needs they have that are met or not met.
Mm-hmm.
And if you have needs that are not met, that's suffering.
Yeah.
And so we started looking at the data that way. We were talking about suffering, but I felt like there was more, especially as a nurse, that we should be doing, because it's not enough to talk about it and measure it. You have to do something about it.
Exactly.
And so that's where the compassionate connected care framework came in. It says that the patient experience is not patient satisfaction. It's not about a score or a percentile rank. It's about understanding that the patient experience is clinical, the clinical care that we provide, it's operational. Are we providing the quality and the efficiency? It's behavioral, connecting engagement with action.
Right.
And then it's cultural. Does our mission, vision, and values, are we internalizing that so that we are all on the same page, delivering the care that we want to deliver to our patients and each other?
Right.
So the compassionate connected care framework looks at the patient experience in its totality. And it is the action that you take to reduce suffering. So themes that came out of that work were things like, we should acknowledge that patients are suffering. Mm-hmm. We should show them that we understand that body language is as important as the words we use, mm-hmm. that we should coordinate their care, that we should give them choice and give back some control, that mm-hmm. we should make sure that we show them that real caring transcends the diagnosis. They're not their doctor's name or their room number or their procedure. They're a person who happens to be a patient at the moment with a life and job and hobbies. And that framework holds up, especially in a pandemic. You know, we're trying to understand right now, how do you connect with somebody when you can't even walk in the room? How do you connect with somebody when they can't even see your face?
Right.
And that simple gloved touch when you walk into the room, putting a picture of yourself and maybe something that's important about you on the front of your suit, hazmat suit, right. Those things matter. And even if you can't spend a lot of time, just letting them know that you're there to take care of them and you're going to keep them safe. Because really it all boils down to safety. Because, you know, I think about Maslow. We all learned about Maslow, and safety is at the bottom of the pyramid. The only things more important are food, water, and sex. Safety is so important, but I may be, especially in today's environment, I may be doing a great job keeping you safe. But if you are alone in that bed and scared, you don't feel safe.
Right.
So it really doesn't matter if I'm keeping you safe, if I don't make you feel safe in my care. That's what nurses do.
To me, that connection, that is a perfect example of the connection of the compassion connected care.
Right.
Because I see people keeping people safe, but the person doesn't feel
That's right.
safe.
That's exactly right.
And that's a huge disconnect.
Yes. Yes. But when you think about that, if, you know, I may do a great job keeping you from falling down, but if you don't feel like I know who you are as a person, that I know what's important to you, then you don't feel safe and you don't trust me and you're not likely to be compliant.
Exactly.
So that's why it's so important. And again, that's what nurses do.
That is so important, what you just said. Can you speak to it more? Because I think what you just spoke about, that phenomenon, what nurses do, can you just expound on that a little bit more? Because I think this is such an important point, that there is a disconnection
Yes.
How can we create this connection as we move forward? What are some of your ideas?
I think that we have to get back to the 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 compassion part of nursing.
Mm-hmm.
What we focus on so much in our education and our preparation as nurses right now is we focus a lot on the technical aspects of what we do. And so we focus on the checklist, and we focus on the documentation, and we focus on the tasks. And what we do is so much more than a task or a checklist.
Mm-hmm.
So we have to make sure that we are combining that clinical care with the art of compassion.
Mm-hmm.
And I think that probably for good reason, we have minimized that art of compassion. And we talk about it, when you think about the BSN essentials for nursing programs and education, we talk about it, but we don't give it the same importance as the clinical skills.
Mm.
And it's every bit as important.
It is.
And it's similarly, when you go into a healthcare facility, there is a lot of conversation about the clinical skills.
Mm-hmm.
When we know that the art of compassion is every bit as important in driving clinical outcomes,
Mm-hmm.
not just patient experience outcomes, but clinical outcomes.
Mm-hmm.
We've got to get back to making sure that it's held in the same high regard as the clinical skills that we teach.
What comes up for me is when we focus on clinical skills, that there's a contraction between the patient feels done upon and contracted, versus when they feel cared for, the energy of the human being opens up and allows and surrenders and is receptive to the care, to the power of healing. And that's a very different relationship to have with a patient and a caregiver.
Yes.
Power of that healing and how that would truly affect the clinical outcomes.
Right. And I think, we've been able to show, because we have the nurse sensitive indicators through Indian QI and the more recent acquisition of the CalNOC registry, to marry with the patient experience and the nurse engagement data.
Wonderful.
So we are able to demonstrate that truly, when you have good patient experience and you have good nurse engagement, you have better clinical outcomes. It all works together.
Mm-hmm.
Intuitively, we've kind of known that all along, but now we know for sure. And by the way, when you have great nursing excellence in your organization, you also have better physician engagement. You have better clinical outcomes. So it all works together.
Mm-hmm.
And I think sometimes we try to distance ourselves from that personal interaction with a patient,
Mm-hmm.
because we think that it will insulate us from compassion fatigue. But in fact, it's the exact opposite, because we know, the data tells us, and we know that people need to know that they're making a difference in this work, that they make a meaningful contribution in this work. And if your job is task-oriented and checklist-driven, pretty soon you really don't feel like you make a difference. You really don't feel like you're making a meaningful contribution. You're just taking care of the gallbladder in 402.
Mm-hmm.
When you find out one thing about that person that has nothing to do with the reason they're in healthcare right now, then all of a sudden you have a different relationship. That patient knows that you see them as something other than their diagnosis, and you realize that you're making a difference in their lives. And that is how you make a meaningful contribution. That's how you feel like what you do is important.
Mm-hmm.
And I think we have to get back to that to move forward in nursing.
That is so true. I think that what you just said, it's the opposite of distancing yourself.
Right.
It's actually opening yourself to allow the encounter with the other human being. What I would say is like feed your soul to where you're filled by
That's
the
right.
care that you give to another person. It's actually filling you up
That's right.
as you give to another human being. And that relationship is so, you don't get tired of that because it stimulates you, it inspires you, it energizes
Right.
you, it fills you, it makes you feel like you're important.
Right. And I think that we are going to have an awful lot of frontline caregivers after this who are going to need some help.
Mm-hmm.
And there will be PTSD for our caregivers after this,
mm-hmm.
because they have given so much of themselves, and we're going to, especially when we haven't equipped them to be able to do that and understand how to do that without developing compassion fatigue, that they do have compassion fatigue. And we are going to, as a profession, need to address that, not only going forward, but right now.
Tell me what some of your thoughts on that are. How can we address that?
I think we're going to need to focus on the positive as much as we have focused on the negative. So we talk about things like appreciative inquiry, right? Let's focus on the things that are going well. And especially right now, when things feel so out of control and so bad, we forget that there's an awful lot of good right now. And I think we need to pull our frontline caregivers back so that they have an opportunity to see the good that has happened. And I think it's going to take a lot to do that. I talk sometimes about positive root cause analyses, right? Yeah. We think about high reliability and a focus on failure.
Right.
At the same time, we need to focus on high reliability and success.
Okay.
So let's pull our teams together, and just like we would ask why until we get to the root cause of what happened that was bad, let's do the same thing in why this was a good day, why this was a good outcome, why this patient actually left the hospital when everybody thought they were going to die.
Yes.
Why did that happen?
Yeah.
Was it because we worked well together as a team? Was it because the doctors really worked with the nurses, and the nurses really worked with the respiratory therapists, and we made sure that we were working together as a team, and we were huddling every day, and I don't know why it happened, but let's figure it out. Yes. So that we can continue to do those good things and have that highly reliable, successful outcome.
Exactly. And that's what I hear you saying is, how do we create a consciousness for what went well?
Right. That's exactly right.
Unless we pause to do that, it's going to go by like, a flowing river. And then you focus on the negative. But if you focus on the positive and really appreciate the positive while it's happening and ask yourself, why was this worked out so well? You become conscious of those connections or technique, whatever it is.
Right. Right.
Yes. So that's kind of the definition of becoming more conscious of what we
Yes.
do and how we do it,
Yes.
the consciousness of nursing,
Yes.
and how we can give ourselves a deeper understanding and awareness, and developing our awareness of why things go well and not just
Right.
focus on when things go bad.
That's right. That's right. So
Yes.
I think there's a lot of opportunity for research and scholarship around that, because that has not traditionally been the way that we function, right? We focus on the things that don't go well so that
Right.
they don't happen again. And it really is turning that paradigm on its head to say, let's start focusing on what went well so that we can do it all the time.
Exactly. And that goes back to safety. Instead of
Exactly.
keeping everybody safe, what is the experience of safety? What does it feel like? What does it look
That's
like?
right.
What were the things involved? It wasn't just this task-oriented checklist to make someone feel safe, and then they don't feel safe.
Right.
And there's
It's
this
both.
paradox that's happening.
That's right.
Yeah.
That's right.
And we could have approached safety with a deeper awareness of what creates that field and feeling of safety.
That's right. That's right. It's
Mm,
both.
it's
It's
both.
both keeping them safe and making them feel safe. Those things are different,
Those
but
things
they're
are
both
different.
important.
They're both important.
Right.
How do you see with you being involved in evaluating patients' experiences and really looking at the practice of nursing? One of the things that I was thinking that relationship, as we become more connected to understanding the impact of our care, that will actually create the reality of the future. When we know what the patient's experience is and how our actions, that will change the way we practice, change what our awareness is, and deepen the evolution of nursing. Can you speak to
That's
that?
right. Well, I think it is the elimination of silos. We talk about that all the time, but
Okay.
it is the elimination of silos both in our facilities, in our healthcare organizations, and also in the data. It's understanding how all of that data fits together.
Okay.
And so rather than focusing on patient satisfaction,
Okay.
let's focus on the culture of the organization, which impacts engagement of the people who work there. It impacts the clinical outcomes of the patients. It impacts the safety of both patients and the people who take care of them. So it's understanding how all of that fits together and then driving performance improvement and high reliability based on that integrated data. And I think that's really important. We are a data-driven profession, and healthcare is very much data. We have oodles of data. We have more data than we've ever had before. We don't necessarily know what to do with all of it,
Right.
but it's when you understand how that data fits together to drive your performance, that's how you become highly reliable, is making sure that you are looking at the data in an integrated way and you are focusing on those things that need to happen all the time.
Okay, that's really important. Focusing on the data and in an integrative way, and then what was the next? Tell me. Say it.
Driving performance improvement
Driving
so
performance.
that you are highly reliable. These things that are important are things that are done always, not sometimes, not usually, always.
Could you be specific about what that might be? An example, a clinical example of that.
So let's talk about falls. Falls are not okay. My doctoral work was in an inpatient rehab facility, and the prevailing opinion was just, falls happen in rehab, and it just happens. When you start looking at the data at what falls do in terms of clinical outcomes for patients who are in inpatient rehab. It
Right.
slows their rehab down, it extends their stay, they become fearful. There are lots of negative outcomes that happen when a
Right.
patient falls in inpatient rehab, and
Okay.
it's not okay. And so it was pulling a team together, a team of people who took care of patients every day, and saying, what do we need to do? What do we need to do all the time to reduce falls, to make falls go to zero?
Okay.
And there was a lot of, well, we'll never get to zero. No, that's not the way we want to look at this. What will it take? What do we have to do all the time to make sure that falls get to zero? And you know what?
What?
They came together and they developed the protocols and education plans and signage and all kinds of things to make sure that people remembered falls are not okay in rehab.
Okay.
And they reduced falls as a result, because all of a sudden it wasn't okay. That falls shouldn't happen in rehab. And so I think that's something, you pull the team together, the people who take care, you push the decisions down to the people who do the work. That's one of the principles of high reliability. And you start to understand what it's going to take to get to whatever clinical outcomes: zero falls, zero pressure injuries, zero bloodstream infections. I remember when I was in the hospital as a manager, as a nurse manager, when CMS started saying we should get to zero central line infections. And oh my gosh, my anesthesiologists, my surgeons, no, we can never get to zero. There are too many variables, too much we can't control. We'll never get to zero. And CMS said, I don't care, you have to do it. And you know what? We did, because we had to. And it's the same with all of these things that we're talking about. The patient experience is a really good example of that. When CMS said, we're going to tie part of your reimbursement to the patient experience, there was the same, oh, we'll never be able to do it, we can't do it. And you know what? Organizations are figuring it out because they have to. And that's where we're going to go. We're going to continue to do that. But what I would like to see is nurses on the front line of that saying, this is what so rather than having CMS say, we must do that, and everybody saying, okay, we will, let's have nurses on the front line saying, we must do this, and then we do it.
That's what I think we need to do in the future. How do you see us empowering ourselves to have that kind of voice?
That's where I think leadership and advocacy and scholarship come together. And I think we need to start while they're being educated.
Okay.
We need to partner with our educators and make sure that we are shaping the nurses of the future.
Exactly.
Not people who can come in and start great IVs and do great documentation, but that together we are shaping the nurses of the future. And so I think that's the difference, I think, is we need to partner more from the healthcare industry and the healthcare education. We need to partner more.
In education.
We need to educate nurses and physicians together.
Right.
In a lot of ways. We need to, nurses and physical therapists and nurses and respiratory, that we need to partner. We're working together as a team.
Right.
When we get out of that educational program. So let's start in the educational program. Let's start teaching together. Let's start making sure that we are developing what we want to take care of us for the future.
Exactly. Because I think that's key. Then we have lifelong communication patterns where we understand each other and we know that we are advocates of each other and that we are actually working together.
That's right.
Well, thank you. As we come to the conclusion of our interview, and it's been absolutely fantastic, do you have any other things you want to mention?
One of the things that I always told my students when I was teaching, my class was leadership and management in the BSN program, so it was the last class before they graduated.
All right.
One of the pieces of advice that I always gave my students is, don't be afraid to take a risk. You know, it's scary to take a risk, but you know, the people who bet big are the people who win big. And so we need to, and in nursing, we need to be willing to take a risk, a calculated risk, but a risk. We need to step outside of our comfort zones and really think about how we move this profession into what we want it to be. And that's going to take a risk, and we got to be okay with that.
That is exactly what I'm hoping, that this is the beginning of meeting and talking to people like you and hearing the different diverse voices in nursing and how to reach nurses who are working in all these different settings, how we can help each other and be a supportive community to help us take the risks that need to be taken. Yeah. Honoring each other and supporting each other and be an advocate for each other, and how we can inspire each other to stand up and do exactly what you're saying. And I really appreciate you saying that, because that to me is what the intention of this telesummit has been. Let's take a risk. Right. Let's create the future. It won't be perfect, but we can't not do it. We have to do it. Just like you said, we have to do it. And it needs to come from us.
That's right.
What do we have to do to make this profession get better? And it needs to come from us.
Yes. Who better?
Who better? Wow, thank you so much. This has been a very, very informative, and I really have learned a tremendous amount from you. And I really feel that everyone who's listening, you've given them a lot to think about, how to move into using data to become more aware, to become more conscious, to become proactive. This is what we need to do.
That's right.
And it's very practical, and it's very concrete. And it's based on, high reliability. One of the things you kept saying is a high reliability for always.
Right. That's right.
Well, great. Thank you so much. I appreciate it. It's been such a delight and pleasure. And thank you. And wonderful. Thank you for the contribution you are making in the nursing profession by doing the work that you're doing, because as we develop these surveys and getting the feedback we need to improve our practice, you are on the forefront of that, and your leadership is greatly appreciated and will create a legacy for the future. I know that.
Thank you. Thank you. Okay. Be well.
Thank you. Be well. Bye.
Bye-bye.